Your doctor has recommended a type of back surgery called posterior lumbar spine fusion with disc removal. This video will help you to understand the procedure. Let's begin by reviewing information about your body. The spine is a column of bones that are stacked from the base of the skull to the tailbone. These bones, called vertebrae, are separated and cushioned by discs that make movement possible. Besides supporting the weight of the body, the spine also forms a protective tunnel for the spinal cord and other nerves that connect the brain to all parts of the body. This protective space is called the spinal canal. It runs the length of the spine between the front and back of each vertebrae. The lower back, known as the lumbar spine, has 5 vertebrae. From top to bottom, they are referred to as L1, L2, continuing down to L5. S1 is the top of the sacrum, the strong base of the spine. Most lumbar spine surgery involves the L4, L5, and/or S1 vertebrae. The spinal cord ends near the top of the lumbar spine. Below the spinal cord are nerve bundles referred to as the cauda equina, which is Latin for horse's tail, a description of how the nerve bundles look. Spinal nerves leave the canal, fitting precisely through openings called foramen that are between the vertebrae and discs. Changes to the spine from age or injury can pinch and squeeze nerves, causing pain, weakness, and disability. Let's look at some examples of how this can happen. Vertebrae can move out of position, one bone shifting forward over the other. Discs can become damaged and rupture, putting pressure on spinal nerves. Bone changes related to arthritis, tumors, and breaks can cause vertebrae to press on nerves. Lumbar spine surgery can be necessary to relieve pressure on spinal nerves, to lessen pain and improve function. Posterior spine surgery can involve the lamina, the back walls of the vertebrae covering the spinal canal. Sometimes only sections of lamina are removed. This is called a laminotomy. When the whole lamina is taken, it is a laminectomy. Both of these procedures take pressure off the spinal canal. A disc removal is called a discectomy. An implant called a cage is inserted in its place between the 2 vertebrae. The permanent cage is first packed with bone chips or other material to help the 2 vertebrae grow together and fuse, so they do not rub against each other. Bones that have been cut during surgery can be stabilized with metal hardware, including rods and screws. Bone grafts and other products may also be placed to encourage bone growth during healing, especially when 2 or more vertebrae must be fused together. In general, back surgery may be recommended when daily life is limited by pain, especially when work, exercise, and sleep are affected, and non-surgical treatments are not helping. Examples of non-surgical treatments that may help some patients include weight loss, physical therapy, spinal injections, and medications. Specific recommendations for surgical treatment depend on many factors, including a surgeon's experience, the vertebrae and disc affected, the patient's body structure, and overall health. All methods need 1 or more skin incision. The incision size and placement varies with each procedure. Be sure you understand which procedure is planned for you. Now let's look closer at an example of a posterior spinal fusion procedure. Medication is given so the patient will be asleep and pain-free during the procedure. An incision is made next to or near the specific vertebrae. The surgeon works through layers of tissue to reach the spine. Lamina and other bone from the vertebrae is trimmed near the affected nerves. The entire lamina may be removed to uncover the spinal nerves. The nerves are gently shifted to the side and the damaged disc removed. 1 or more permanent implants are inserted between the vertebrae. The nerves are released to their normal position. Bone graft material, rods, and screws are placed as needed. Muscle and tendons that cover the spine are put back into position. The skin is closed and a sterile dressing is placed.